Now, which of the following statements regarding an idioventricular rhythm is correct? Would you say it's A, the most common cause is failure of higher pacemakers? B, they are accompanied by non conductive P waves? C, treatment focuses on increasing blood pressure? Or would you say D, these patients are hemodynamically unstable? Now, I do think this test question would be kind of challenging for a lot of students. And let's talk first off, what is idioventricular? Idioventricular is when your ventricles have to be the primary pacemaker of the heart. And if your ventricles take over, the normal ventricular rate or intrinsic rate is 20 to 40 beats per minute, which is extremely slow. Now, the problem with that is over time, these patients will become hemodynamically unstable. And of course, the goal of treating a patient with idioventricular would be to increase the rate of contraction, not just to focus on increasing this patient's blood pressure. So I'm just going to go ahead and rule out C. D is actually a great answer. These patients are hemodynamically unstable, but that is an absolute. And if you know anything about testing, you know to stay away from absolutes, to say that these patients are always or only or never, right? This all it says is these patients are hemodynamically unstable. I would say that there's probably a good chance that they will become unstable, but I would stay away from D as well. I see D as a trap for a lot of students. B, they're accompanied by non-conducted P waves, just means that the patient has a atrial rate, but there are no QRS or no ventricular contractions that are occurring after that atrial contraction. And we know that that's just not happening, right? Remember, the whole purpose of it being called idioventricular means that the primary pacer is now the ventricles, has nothing to do with the atria. So B, we can just go ahead and discard that as well. And that leaves us with A, the most common cause is failure of higher pacemakers. Remember, the conduction system of a normal heart or the primary pacemaker would be the SA node, again, found in your atrium. And the normal intrinsic rate there would be 60 to 100 beats per minute. But if your SA node fails, your backup is going to be the AV node, and the AV node will start taking over. We call these rhythms junctional rhythms, right? And if you remember junctional escape, the normal intrinsic rate there is 40 to 60 beats per minute. But guess what? If your SA node fails and the AV node fails, then your ventricles have to take over. And that is what idioventricular is. Again, the most common cause is because those higher pacemakers have failed to do their job and now the ventricles are taking over. The best answer here is A.